Today's Imprint Weekly podcast is brought to you by Accenture. Change is afoot in child welfare. Change that means agencies focus on results for children and keep far more of them safe at home with their own families. Accenture's child welfare team is leading the way in the effort to ensure technology does its part in that success story. Accenture offers cutting-edge case management tools that ensure agencies can see insights that drive decision-making and caseworkers have information they need at their fingertips. Together, these tools help agencies stay laser-focused, reinventing child welfare into a source of strength for families when they need it. For more information, visit www.accenture.com/childwelfare.
Hello and welcome to the Imprint Weekly Podcast. I'm John Kelly, Senior Editor of the Imprint, a daily news site covering child welfare and youth justice around the country. You can read all of our coverage at imprintnews.org or check us out on Facebook or Twitter at the Imprint News. You can sign up on our homepage for our free weekly and monthly newsletters. And for professionals in child welfare and youth justice, subscribe to our Youth Services Insider section for a closer look at news on business, policy, and practice. The Imprint Weekly Podcast is also a member of the Safe Camp Audio Network. Check out our show page and all of Safe Camp's other great podcasts at safecampaudio.org on the web or Safe Camp Audio on social media. On this week's episode, I am joined by my Imprint colleague, reporter Michael Fitzgerald, to talk about his incredible investigative reporting looking into sexual and reproductive health policies and access for youth in foster care. It's an issue brought into sharp focus last year when the Supreme Court overturned Roe v. Wade. Before we get to that, let's knock out a couple of headlines before we get to the interview. Every 2 years, Child Trends puts out the most comprehensive and scrutinizing analysis of child welfare spending in America with state-by-state profiles, as well as national aggregated figures. It's really great. Obviously, not every state is as equipped as the next to provide really granular numbers to them. But to the extent possible, they give a great breakdown of how much federal, state, and local money is going into child welfare and what part of the system, so to speak, that every dollar goes into. So they break it into prevention, child protection, foster care, adoption, guardianship, etc. This year's report, which I will link to in the show notes, I don't think will ever be topped in terms of wild fluctuations. More often, this report captures kind of subtle trends year to year. But when you think about the capture of spending in between 2018 and 2020, there were obviously all kinds of changes afoot in the country. So check out the main page where you can jump into the final report, the state profiles, the funder profiles. Just a few top line things, though, that I want to kind of pull out of here and raise up for folks. And I'll hit most of them quickly and then spend a little time on the last one. So first, overall, child welfare spending has been pretty flat, up 1% across the decade from 2010 to 2020. And then a 1% increase also from 2018 to 2020. I believe the number was about $31.8 billion total when you combine federal, state, and local money going into child welfare that Child Trends was able to sort of isolate. Second, much has been made of the fact that Title IV-E, which is the biggest piece of federal child welfare funding, has continued to cover less kids as the outdated income test around foster care money makes it harder to be eligible. And I'm not going to go into all the details about that, but basically 4E covers now prevention of foster care services, foster care, and then adoption and guardianship. But really, there's basically no income test for the prevention services, which are pretty new. Adoption, basically by, I think, 2 years from now, there won't be any sort of income test to qualify for that. But the foster care, it's still rooted to this 1996 definition of poverty connected to the parent of the kid. See, I said I wasn't going into it, now I'm going to it. But anyway, there's an income test that has caused less and less kids over time to be eligible for 4E. But what this shows is that the share of federal dollars for child welfare that are 4E dollars is actually rising. So if you just see the pie of federal money going into child welfare, while 4E is covering less kids, it's representing more of the money going out to states. It was 53% of the dollars going out to states in 2010. It is now 57%. Third, and I kind of alluded to this earlier, there were just sort of wild fluctuations on paper. With 4E in particular, there was a ton. Well, the amount of it going to foster care rising by 49%, the amount going to guardianships with relatives and fictive kin going up 35%. But while that might look like a pretty wild swing, it kind of seems clear there's some logical explanations for why these numbers are jumping so much. First, for all the fanfare about, Title 4E waivers that states used to get. So there used to be these waivers available for states to basically just sort of take the money that comes to them from 4E, which is an entitlement and supposed to be kind of a match between federal and state money, and sort of get it more flexibly, for all the fanfare about flexibility. And there was some important aspects of that. Most of the spending of those waivers was either pretty much on stuff that would have been fine anyway. So the waivers went away during this 2-year period because they were set to sunset as the Family First Act took effect. So even with a little bit of makeup money going to states that had the waivers to kind of ease their transition, 4E waiver spending or money going to these waivers went down almost 70%. So basically what you see there is, the waiver money, a lot of it was probably going to pay for foster care. The waiver status went away. So that money, the amount of spending fell off a cliff. And then a lot of it gets recategorized as what it was spending on foster care. On top of that, most of the big COVID era family supports like child tax credit, which never really would have been part of, true child welfare spending, all the stuff we think about as kind of like boosting spending on families during the pandemic, a lot of it would have kicked in after the period covered in this child trends report. But one piece of stimulus that kicked in really quickly once COVID hit was this increased match on things like Medicaid and 4E. So entitlement programs, I think really right in the first stimulus, I think in April, states were able to get a much higher match of federal money on that, and that kicked in right away. So that was really captured in what they found here. But I think the most interesting trend to watch that jumps out here is the ascendance of Medicaid as a federal payer in the child welfare world. And I apologize that we're kicking off the podcast on a Monday morning for a lot of people that are listening on the first day with a lot of wonky federal talk, but this is some important stuff. And, dollars represent action. So how this money gets spent matters. As mentioned, Title 4E is the big kahuna when it comes to child welfare funding. The next two biggest, as child trend services here are temporary assistance for needy families, which is, supposed to be a welfare program that mostly supports families directly, but a lot of states use for things like child welfare services. And then social services block grants. So those are both, I think, in between like $1.5 and $2 billion each as far as child welfare spending goes. So Medicaid is still below those two and obviously below 4E, but it is up. And those two, TANF, the welfare payments, and social services block grants, they are kind of descending the amount of money from those that go to child welfare. Medicaid is up. It's up almost $1 billion. It's almost to $1 billion. And the amount of Medicaid funding going into child welfare services is up 20% from the year 2014, which it was when it hit, I think, about $830 million, and now it's at $993 million. Okay, so as mentioned, the most recent part of that increase can be explained a little bit by this more generous matching that happened during COVID, right? States were just getting more of a match on Medicaid from the feds, but that doesn't nearly explain even the increase from 2018 to 2020, and it definitely doesn't explain the quite rapid increase in Medicaid funding going into child welfare, between 2014 and 2020. So here's what Child Trends had to say about all of this that really caught my eye. And I'm just going to read a little section from the report's analysis here. It's 2 paragraphs. While the reason for the remainder of this increase is not entirely clear, it is possible child welfare agencies are using Medicaid more frequently to cover the cost of institutional placements because of restrictions on Title 4E congregate care reimbursement and rules governing Medicaid reimbursement for services for children in certain congregate care settings. This explanation is supported by our 2020 survey data indicating that Medicaid became a top funding source for congregate care expenditures. This explanation could help explain the increase in Medicaid expenditures by child welfare agencies, although it is important to consider this explanation as a hypothesis that requires more exploration. So I know that was a lot. Let's break down what was just said. The quote, restrictions on 4E congregate care that Child Trends mentions is a reference to the new rules in the Family First Act, which halt federal 4E money going to congregate care at 2 weeks unless the placement is in one of a few exceptioned out buckets. Pregnant and parenting teen is one, youth at risk of sex trafficking, older youth, people over 18, and then qualified residential treatment programs. Stick a pin in that last one. We're going to come back to it in a second. And what Child Trends is calling out here in this section, as far as my read of it, is that it's a plausible theory for the rise in Medicaid spending. It's that it's being used more to pay for group placements as the use of 4E for these placements gets harder. And that theory is supported, they're writing, by the fact that in their survey with states, Medicaid is now a top 3 funding source for congregate care. So they ask every state to name in all these different buckets, foster care, guardianship, prevention services, and in congregate care, they're asking name the top 3 payers, whether it's state, local, 4E, TANF, whatever. And in the congregate care, what they're calling out here is that really for the first time, Medicaid is now a top 3 funding source for congregate care. And here is why that is quite surprising to me. Traditionally, rules around Medicaid forbid its use to pay for institutional settings. It's called the Institutions for Mental Disease Exclusion, or the IMD exclusion. And there are a couple of caveats to it, particularly for young people. If a young person is in a psychiatric hospital, or they're in a psychiatric wing of a hospital, or if they're in something called a psychiatric residential treatment facility, which has got a lot of rules around, medical staff being on the grounds and how, the whole thing is managed. It's called PRTS. Usually you'll hear it called that. If you're in one of those, then those are kind of exceptions to this IMD exclusion. And then there's another kind of caveat to this, is that this covers places that have 16 beds or more. So if the place has less than 16 beds, Medicaid is fine. Now, Family First kicked up a lot of worry among states that the law was going to jeopardize the use of Medicaid in child welfare. Remember, I mentioned there were exceptions to that 4E limit that just became part of Family First on congregate care. And one of them is this qualified residential treatment program, which is a designation that is supposed to be kind of reserved for, residential programs that are treating kids with acute medical needs, psychiatric needs. And it's definitely not on the list of exceptions for Medicaid. So you're not, QRTP was created as a designation in Family First Act. It has not been named an exception as a place where you can spend Medicaid money in an institutional setting. So the worry was, among all these state child welfare managers, all these residential programs that would go and get licensed as a QRTP so that they could hold kids for more than 2 weeks with federal funding, that they're basically walling themselves off from tapping into Medicaid to pay for their services. But the truth is, and I'll post a link to a deep dive that we did on this a couple of years back, states have been billing Medicaid for residential psychiatric care and foster care for a very long time. It is not new. The fear was that this new QRTP designation would sort of force the federal government, and particularly CMS, which is the federal agency that kind of oversees Medicaid and Medicare, basically from looking the other way. That is really kind of at the core of this. The states have always been tapping into Medicaid to pay for residential care in foster care that doesn't really line up with the IMD exclusion rules. But, CMS is not a very large agency. They get just, I don't think this is overstating. I think they get millions of requests for, reviews and complaints every year. And it's this very tiny, small staff place. And I just don't, the reality is they were not looking to scrutinize child welfare systems for using Medicaid in this area. So what Child Trends finds here, is quite counterfactual to all of that worry in a way that kind of makes you wonder how it's possible. Medicaid is being used more, not less, to pay for congregate care. And that is, by the way, at a time, the number of youth in foster care recently peaked at in about 2017. I mean, there's been higher numbers back in the 90s and 2000s, but the recent peak in foster care was 2017, and it kind of leveled off. And then by 2020, sort of the end of this report, it was definitely going down. So more Medicaid being spent, not less, in aggregate, less kids. And we know that the number of kids in foster care who are in congregate care has been going down for years. So what gives here could be that more foster youth are getting placed into these hospitals and psychiatric residential treatment facilities, right, that are kind of shielded and allowed to spend Medicaid money. Those are very expensive, on a per day basis for sure. So it wouldn't require that big of an increase to cause, a pretty big spike in spending numbers. So you could have a relatively small number of kids who are in those places, and see an uptick in that and the money go way up. It's also possible that states are kind of getting creative or leaning more, at least, on programs with small bed space or, keeping programs rated capacity of bed space to 16 or lower, at which point Medicaid can be a payer. And of course, it's also possible that, the federal government continues to not really look very hard at the use of Medicaid to pay for residential care that is pretty clearly, not permitted under Medicaid law. All right, so that was a fairly wonky deep dive to start us off in the headlines. I'll go quick through some other stuff. A few months ago, a grand jury in San Bernardino County, California, found the county's foster care system too broken to fix. That is a quote by the grand jury. That is, of course, an untenable reality. You can't just say something is too broken to fix and then walk away. And now a class action lawsuit has been filed seeking to force reforms on the county. I will link to our story on the lawsuit, but in a nutshell, what it's alleging is that youth in San Bernardino County foster care remain there way too long. I think it's 24% higher than the national average, and that they are far too frequently abused in foster care. It's a very outsized rate of that. In some cases, according to the lawsuit, by caregivers that the county knew were bad news. We'll kind of keep up on this in the Imprint. This is a sneaky big system, San Bernardino County. You don't think of it as certainly people outside of California won't. It's about the population size of New Mexico with more kids in care than that state. So we'll keep our eyes on that lawsuit as it develops. Updating on something we discussed a few weeks back on the podcast, I mentioned that there are 2 different states that have legislation pending that would institute both oral and written statements of rights to parents when CPS workers showed up to investigate and enter their homes. So generally been called the family Miranda movement, assuring that parents are apprised of the fact that they don't necessarily need to let somebody in from the government to investigate inside their homes and examine their children. And those states could not be more different. We're talking about the very conservative-leaning Texas legislature, which has already passed this family Miranda type bill in both of their chambers. And then you have the very liberal-led New York legislature, which has similar bills in both of its chambers, along with some rules in New York that would rein in anonymous reporting to the abuse and neglect hotline. So the update here is basically that, there's deadlines looming on both of these. We will know, I think, by the end of the week we're releasing this podcast, at least part of the fate of both of these for the year. So the bills in Texas the final bill was passed on May 24th, according to the records in the, legislative tracker. According to Texas law, the governor there, Greg Abbott, has 10 days to sign or veto the bill. If he chooses to do neither, then the bill would become law on September 1st. And then in New York, both of the bills are still in committee, and the deadline for things to move out of committee in New York is June 8th. So if it doesn't get out, it'll get approved by committees on votes in either chamber by June 8th. That would be it for the year. And I think it would be very interesting next legislative season in New York, if this somehow doesn't move along, what kind of effect or persuasion it would be that, one of the most conservative legislatures in the country passed the protections for parents at the front door from CPS, while the state, has continued to kind of just, it's been a couple years now that this has gotten to the committee stage and not moved out of it. So a waiting game in both. Probably we'll be able to update listeners sometime next week on both of these. Another thing likely to come down soon, which we have not discussed much of late on the podcast, but we did a whole bunch of work late last year, is a decision in Brackeen v. Holland, which is a Supreme Court case that could determine the future of the Indian Child Welfare Act. As I think most listeners know, ICWA was passed in 1978 at a time when we were removing, up to a third of Native American children from their homes, placing them in residential programs, boarding schools, but, more recently, I guess in the 70s, into the homes of white foster families. So there is theoretically a chance that the case, Brackeen v. Holland, could not be decided during this term, but more than likely it will be, which means that one of these upcoming Thursdays in June, that being June 8th of this week, 15th or 22nd, we will get a decision in this case, because the court has been releasing opinions on Thursdays. June 22nd would be theoretically the last Thursday before they go home for the summer. I think they take all of July, August, and September off. The imprint will, of course, be all over the decision once it's out, so check our website or social media to get up-to-the-minute updates and analysis on that. I will say, and she said this on our podcast, the great ICWA expert Kate Fort pointed out, this might be a decision that you don't want to quickly react to. It could be a pretty dense one that requires some deep analysis and assessment of what it all means when it comes down. Definitely a possibility for some, split opinions. You'll get a majority opinion and a dissent, but you might get some other responses as well. And that's because the likely outcome, I think, will not be that ICWA is entirely scrapped or that it's entirely upheld. I'm not sure I've come across anybody who believes that either one of those options will occur. The court accepted all kinds of questions about the law. So the guess here, is that on some parts, ICWA is going to stand up, and it will be a matter of which pieces of the law a conservative majority feel are either beyond the, so-called plenary powers of Congress to regulate relations with tribes, or, something that a conservative majority feels violates the, so-called anti-commandeering doctrine, which is kind of a pretty new legal theory, relatively new, saying that the federal government cannot require states or state officials to adopt or enforce federal law. We're a few weeks into the month where most of the decisions come out, and, a lot of the most well-known cases are still out there. In addition to Brackeen v. Holland, just to name a few, we've got Students for Fair Admissions v. University of North Carolina, and then the same organization v. Harvard. Those combined could determine the future of the constitutionality of affirmative action. Biden v. Nebraska and Department of Education v. Brown, that's going to decide whether the administration's student loan forgiveness program will stand up. 303 Creative v. Elenis, which will decide whether, it's about whether a business owner could be sanctioned for refusing to work on same-sex weddings. US v. Texas, that's a challenge to, ICE's use of prioritizing policies around who to pursue with deportation. There's a whole bunch of cases, very high-profile cases, that Brackeen is just one of them. So we're going to hear a lot from the Supreme Court in the next 3 weeks. Last but not least for this week, Santa Clara County, California has taken intentional steps towards largely removing girls from the county's juvenile detention halls and camps. And a new initiative will aim to achieve the same in 4 other big counties in the state: Imperial County, San Diego, Sacramento, and Los Angeles. So in the first year of this initiative, those 4 counties are going to get, $125,000 each to conduct some research, I think working with the Vera Institute in New York, to create local plans that offer more home-like alternatives to detention centers. The counties will then be eligible to go and get a $750,000 grant to actually do the work. This all kicked off, like I said, in Santa Clara County, which basically, at one point had gotten actually down to 0 girls who are incarcerated in the county. So I'll link to our story about the Santa Clara County experiment and then some more information about this new one in California. Pretty cool, though. All right, when we come back, our interview with Imprint reporter Michael Fitzgerald about his investigative series on sexual and reproductive health access for youth in foster care.
The National Association of Counsel for Children advances children's and parents' rights by supporting a diverse, inclusive community of child welfare lawyers to provide zealous legal representation, and by advocating for equitable anti-racist solutions co-designed by people with lived experience. Learn more at naccchildlaw.org, counselforkids.org, and at our 46th National Child Welfare Law Conference this August.
We are joined today by Imprint national reporter Michael Fitzgerald, who recently put the finishing touches on our series, High Stakes Silent Systems, a deep dive on sexual and reproductive health policies for youth in foster care. And I say final touches. Of course, we might have some more coming, but we've put out the first 3 in this series, and I will link to any listeners who want to read that can go to our show notes and check that out. Michael, thanks for joining us on the podcast today.
Thanks for having me.
Got to give the folks a favorite, just like every other guest. You're not exempted for being an Imprint employee on that one. So movie, TV show, sports team, book, or musical group, what do you got for them?
Well, I'm enjoying the show Pachinko. I don't know if a lot of people have heard of it. It's kind of under the radar, but it's pretty interesting history I was not familiar with. That's on Apple TV. Sports team, I was devastated by my Philadelphia 76ers loss in the playoffs again in the second round recently. So that was a bummer.
Rough. It's been a rough year for Philadelphia. A lot of also ran going on in the sports world.
A lot of near misses from almost every Philadelphia team.
Tough. It's tough. Okay, so I want you to tell listeners sort of how this whole project came about, because it's been, by my estimation, about a year since we started to talk about this. You guys took this in a whole wider, direction than I ever thought, because my recollection is the Dobbs decision came out, overturned Roe v. Wade last year in around June, I think. And, we got off taking people inside the newsroom. We're just like, this is obviously a significant thing for parents, for families, for kids. What do we need to surface? What do we need to be talking about in these spaces that we do? And that's kind of where I off the train. So tell folks sort of how this got started and how you ended up getting where you went.
Yeah, well, as you said, after the Dobbs decision, I think like every news outlet in the country, we were asking, what does this historic decision overturning the guaranteed right to an abortion and overturning Roe v. Wade, what does it mean for the communities that we cover? But, it quickly became apparent as we started speaking to people around the country, speaking to young people, families, professionals in the child welfare system, and also looking at policies that there may be a much wider range of more fundamental issues before you even get to the point of pregnancy for adolescents in foster care in particular. And so it kind of blossomed from there.
Yeah, that's absolutely right. And so you guys kind of quickly came up with this idea of let's take the broader scope and look at all of the, things that go into making sure that a foster youth would be properly educated, have access and all that to contraception and reproductive health. How did you go about doing this story? Take people into sort of the process for how you found out everything that we're about to talk about.
Yeah, well, it was pretty straightforward in some sense. We just went on the websites for every state child welfare agency, and we started looking for all of their policy manuals, all of their annual reports, regulations, whatever we could find that would discuss any issues around sexual and reproductive health for young people in foster care. In the end, I imagine we searched tens of thousands, maybe hundreds of thousands of pages of documents. We didn't read every page, but we were searching for keywords, and we were also asking people in each state, where could we find the material that it would be relevant to these issues. So in the end, we did do all 50 states. We reached out to dozens of them to also confirm that we had found the right material. And while we were doing that, we were also comparing the policy manuals for those state child welfare agencies that run foster care systems with the broader state statutes, the laws for each state. We all know right now states are changing their laws for many of these issues around sexual and reproductive health. So we would compare the child welfare manuals, the the guidelines for caseworkers and foster parents and other supervisors and professionals with what the state laws were for minors' access to, again, sexual and reproductive health services and sex education.
All right. So, as you said, a simple process, but certainly not an easy one. That's a lot of work to do to review all that stuff, run it back against the states, and not to get too far ahead of the findings, but always satisfying with a reporter. You definitely encountered some points where you guys, in particular you, were surfacing things to some of these state officials that were in the code and in the policies that maybe surprised them a little. Might prompt some changes to the language that's on in these policies.
Yeah, I mean, well, just stepping back, I think part of the reason we thought this was important was that, we found a very broad consensus that these issues are incredibly important and high stakes for youth in foster care and who have just left foster care. There are significant needs that are not being met, it seems, and there seems to be a pretty broad consensus about that, whether it's high rates of teenage pregnancy or exposure to sexually transmitted infections, or just, a lot of challenging or frayed relationships in their lives. So it's, there's lots of research kind of confirming that the needs are there and young people are asking for more support on these issues. But we did find, a lot of confusion about what a young person in foster care, given their status as being in state custody, what can they consent to themselves in terms of medical services such as birth control or prenatal care or abortion, but also, sex education.
So let's get to that. So, there's a lot of different findings in here. And again, I would strongly recommend that you go and read all of the great work that Michael's done on this on the website. And again, I'll drop that in the show notes. But let's stay with the two kind of big takeaways and first talk a little bit about the absence of sexual health education in these policies around foster youth.
Yeah, so I think our kind of biggest picture findings were that, number one, there's often are no policies around these issues for dozens of states. We found 10 states where there was no explicit discussion of things like sex education or birth control. But then there was also about 28 states where there was maybe just the briefest of mentions of kind of encouraging caseworkers to make sure that young people, to ensure that they have been offered at least some kind of education or connection to some kind of reproductive health provider. Then we found a handful of states where it seemed like the policies that were there, particularly for birth control or abortion, in terms of describing the ability of a minor in foster care to consent to those sensitive health services, it seemed to conflict with the state laws for minors' rights to consent to those things, whether or not they are in foster care.
Right. So in that last thing you said, what you're getting to there, so we talked a little bit about the absence of sexual health education policies, but you guys also really identified many states where the policies are either confusing and kind of uncertain around youth's access to things like contraception, or they sort of suggest an unequal standard between what a foster youth has access to and what any other kid would. Can you talk a little bit about that?
Yeah, so as an example, and again, we're talking about instances where it appears that foster youth are not being offered the same rights as other young people would have in those states. And in fact, we spoke to one expert who, when we described these examples, and I'll walk through one of them, we talked to one expert who said that these findings seem to highlight the barriers that all young people in foster care face in accessing reproductive health care, which their peers do not. And the situation, she thought, looks ripe for a lawsuit, since in some states, young people in foster care appear not to have the same rights to reproductive health care as their peers who are not in foster care. So one example of this was in Alaska. In that state, the highest court has ruled that requiring parental consent or a judge's permission, pregnant minors seeking abortion violates the state constitution. That was a 2016 ruling that applies to all young people, including those in foster care. Yet the Child Protection Services Manual in that state, updated last May by the Alaska Office of Children's Services, states that for a young person in foster care seeking an abortion, a physician is required to notify the parents, legal guardian, or custodian, unless the court has ordered notification. One of the plaintiff's lawyers from that 2016 case told us that that's wrong. The department is either blatantly not following the law, or nobody bothered to edit these documents to bring them up to date with the law. So when we asked the state agency about that, they responded that the policy was actually inaccurate and would be updated as soon as possible. And it had wrong information, as they put it in an email to us.
Yikes. Yeah, that was really interesting about the comment about this being ripe for lawsuits. So I guess, not to put words in the mouth of the expert who said it, I guess that would run along the lines of you would challenge a policy that puts some sort of, seemingly arbitrary layer of procedure or protocol on a foster youth to get something that the state law clearly says, you know, no, there should be unfettered access for this age group. I guess that's how that would go. You challenge the policy in court.
Well, yeah, I think it's important to note here also the extent to which these state policies, again, these are child welfare policy manuals, the extent to which they're actually enforced is unclear. Young people can and often do get the help they need, regardless of what a manual may or may not say. They might get help from other adults other than their caseworker. Caseworkers might not be aware of the policy manual, might help a young person access birth control, for example, without consulting a judge, because some states, many states, most states allow young people to consent to that themselves without parental consent or needing a judge's permission. And we did speak to local advocates in Alaska and other states who said that it is really hit or miss whether or not young people get the services they need. So it's not clear whether it's enforced. Again, the state agency told us it was just, the policy had the wrong information. They didn't specify specifically what was wrong, but it seems very possible in many of these states that where we found things like that, they're not heavily enforced.
Yeah, I'm glad you brought that up because I did think that the one former foster youth that seems to be working with current former foster youth or current foster youth in Alaska, I think that really typified the situation that's created when there's this much vagary, right? It's like you could have for every 10 kids who want some access to sexual health information or resources, maybe 8 get them, but because 2 have caseworkers or people in their lives who don't believe they should, if you don't have some sort of kind of like well laid out, rules, that's just going to create that gray area. And we just don't know. It's not like that's not easily trackable. It took you guys doing the work that you did just to service what's on paper, let alone like what's actually happening out there,
Yeah, and we shared these findings with a lot of legal advocates and experts, as well as former foster youth. We spoke to one in Pennsylvania, Stacy Johnson. We kind of described the kind of vast discretion that seems to have been left to frontline staff and caregivers in the foster care system. She commented that, with some policies, ambiguity is good when you need the flexibility to be creative. But with this stuff, we don't want you to be creative. She thought it was inexcusable that because these issues are not new. They've been around a long time. Yeah. And to her, it was just an example of more trauma that youth aren't given the services to deal with.
I want to kind of pump up the first of those 2 findings a little bit because I think there's kind of rightfully so, but I think there's more of a focal point sometimes when people are talking about what's wrong or what can be improved in systems like child welfare on things that kind of point to like a different standard, right? Or something in law that's already been written. It's less sexy to talk about things that are just simply absent. Your reporting on this made me think of the time I went looking for what each state juvenile justice system's policy was on prescribing psychotropic drugs in facilities. And like the finding that just wasn't that compelling and we didn't get as much sort of traction on was the fact that there were like 30 states that just had no rules, right? But like it was the ones that tracked it and actually could provide data that sort of kind of caught the most guff, honestly, for the findings. Same deal with like the minimum age of arrest, right? Like you'll see a lot people say like North Carolina lets 6-year-olds get arrested, or this state lets 9-year-olds get arrested. Well, half the states just don't even have a rule. They theoretically a 1-year-old can get arrested in them. So I just think that was really important for you guys to raise up was just, in the majority of states in this country, they just simply take a pass on sort of any sort of codified expectation or guarantee that foster youth are going to have access to sexual health education.
Yeah, and to be fair, we spoke to a lot of state agencies, and a lot of them made the point that schools are responsible for providing sex ed, for one. We had one state agency tell us they didn't think they had the rulemaking authority. And we also spoke to officials who also just kind of made the point that they are not experts in sexual and reproductive health. They are experts in child abuse and neglect. So there was a significant fear, it seemed, of kind of overstepping their bounds. But the response to that I heard from one sexual health educator that, that's part of the issue. There's no one person who's identified as the person to make sure young people are getting the services they need and the education that they need. So that's why it could be a while till we see, kind of a comprehensive approach to this.
So, I mean, to somebody, who's either in a child welfare system or an advocate who may feel like this is somebody else's job to do this, can you speak a little to why it's so important to ensure, these rights and this access and this education is made available to foster youth?
Yeah, well, number one, I think if you watch young people on panels or on webinars in recent years, this is an issue that frequently comes up. I was at a conference just a couple of weeks ago organized by the Reproductive Health Equity Project of California. It was organized entirely around exploring the significant needs that young people have in these areas. But there's also scores of studies that we found. One 2018 study, Foster Youth Needs Sex Ed 2, as it's called, noted that young people in foster care often have a history of inconsistent relationships, childhood trauma, and broken support systems. So there are studies showing that youth who are surveyed, who have been placed in foster homes or group homes or detention settings, many are not made aware that condom use can decrease their risk of getting HIV or AIDS or other sexually transmitted infections. And then tragically, there are very high rates of intimate partner violence or experiences of sexual abuse or harassment documented in many other studies involving foster youth.
I think that Theo Ices of Colorado put it really well in your interview with them for the end of the series thus far, when they said, the deeper you are in systems, the less agency you have over your body, over who touches your body, over how your body's touched, over where you are, over how you dress, over how you're allowed to speak, over so many things. It becomes really deeply important that we affirm that, no, actually, you have choice over your body and over yourself and your decisions. So I will, again, link everybody to all the great work that Michael's done on this. High Stakes Silent Systems is a series. Look for it on the Imprint website. Michael Fitzgerald, thanks for joining us on the Imprint Weekly Podcast.
Thanks, John.
Thanks to Imprint reporter Michael Fitzgerald for joining us today. The Imprint Weekly Podcast is a production of Safe Camp Audio Network, which is a division of Fostering Media Connections. Please visit safecampaudio.org on the web or Safe Camp Audio on all major social media to check out all of Safe Camp's offerings in the podcast arena. This podcast is produced and mixed by Christina Anjoko with music by Luke Giroux and Cyrus Elia. If you enjoyed this episode, we'd love it if you consider subscribing or giving us a 5-star rating on Apple, Spotify, or wherever you download your podcasts. And we would greatly appreciate if you would support our work here on the podcast and in print. Small donations from our listeners and readers go a long way towards helping us grow and cover more great stories in child welfare and youth justice. To support us is very easy. Just visit imprintnews.org/donate. You can follow The Imprint on Twitter and Facebook by searching the handle @TheImprintNews and visit us on the web at imprintnews.org. You can email us at tips@imprintnews.org. I'm John Kelly, and we'll see you next week.